These are just some of the nurses, doctors, health and social care assistants, all who've sacrificed their lives to save ours. The Black, Asian and minority ethnic workforce in the NHS are being hit hard by this deadly virus, and we need to know why. This is the man tasked with tackling racial inequality within the health services workforce.
The fact that a high number of black and minority ethnic staff are dying from this pandemic is a worry for us. It's a challenge for us, but we need to rise to that challenge. And what we need to do is look at what we can put in place right now to support our staff.
Dr. Naqvi believes a lot of the BAME workforce have a different work ethic, a more hands-on approach, he said, and that right now could be a huge downfall.
What we do know is that every member of our NHS workforce is absolutely committed to patient care. But there may be parts of the workforce that see working in the NHS as more of a vocation than an occupation.
Our analysis shows 72% of all health and social care staff who've died with COVID-19 are from a BAME background, but make up just 21% of the workforce. Around 19% of patients to die in hospitals in England were from ethnic minorities or mixed backgrounds, but that figure is proportionate to the population figures. The main difference is among Black, African and Caribbean patients, but the numbers here are small. And 10% of the data is missing. The population figures are dated, and the two regions with the highest number of deaths, London and the Midlands, are also the most ethnically diverse. There are a number of reasons behind this potential issue. We know that many Black and Asian and minority ethnic people are key workers, whether it's on the front line in our hospitals, driving buses or working in supermarkets. Their vulnerability to this virus could be automatically increased. But the stats show a high number of BAME families are living in overcrowded and multi-generational households, making it almost impossible to social distance. And the science is clear that underlying health conditions like type 2 diabetes and heart problems are prevalent in these ethnicities. But further research needs to be done, and today a group of 17 non-executive directors in the NHS have written to the government offering their experience and knowledge as an independent advisory group.
We can bring our expertise from various sectors, we can bring our knowledge of the NHS from a strategic perspective, and we can bring that insight that we have in the BME community. You know, that knowledge, that understanding of cultural experience, that understanding of cultural intelligence. We can bring all of that together.
It may be true that the coronavirus doesn't discriminate between race, class or creed. But as the names and photographs emerge of those who've lost their lives to COVID-19, the real life and death implications of social inequality are becoming increasingly apparent throughout this pandemic. Inzamam Rashid, Sky News.